Hey guys, so I am here to talk to you about some of the pros and cons of owning a staffing agency. Whether you are in IT or healthcare or any sector, the pros and cons are going to be very similar, right? So I want to talk to you about that. Before you remind me in the comment section, I know we should not be driving and making videos. So I know that already. So don't tell me that in the comment section. I just wanted to do this video before I forgot about it. Yeah, because I've gotten this request and I wanted to kind of just share it. So I have the pleasure of mentoring a lot of staffing agency owners, especially those who are looking to come into staffing. I do like a 30-minute paid consultation where you can ask me whatever you want before you even dive into the staffing firm, right? So you can pick my brain and see some of the pros and cons that I've learned over the years as a staffing agency owner. Specifically healthcare, that's my sector. But I feel like once you know healthcare, the other healthcare is the more complicated one. The other ones are not as complicated, but healthcare is complicated. Anyway, with all that said, guys, hi, welcome to my channel where I teach you some cool stuff to help you learn more and do more and be better. There you go. So some of the pros of starting a healthcare staffing agency, like pros wise, right, would be I'm trying to think, you have a lot more freedom, right? So you have, depending on how you set up your agency, let me just clear that out. You have a lot more freedom, flexibility in schedule, and that really just comes with owning a business. You have a lot more freedom. You can make as much as you want or as little as you want, depending on the effort that you put in to your staffing agency firm, and depending on how much you invest in it. You can make as much as you want or as little as you want. Let me see, another pro. You get exposed to more of the professional sector of healthcare, I guess. You get invited to some CEO stuff, like staffing firm. I'm sorry, guys. You get invited to, different companies' dinners, or different, let's say, vendors want to sell to you of software. You get invited to those kind of things. Those are some of the pros. I feel like I have a lot more cons than pros, but to be honest with you, don't let the cons deter you, right? Because I'm not one of those people that I'm in the business and I'm trying to convince you not to be in the business. That makes no sense. Then if it's that bad, why am I still in it, right? So some of the cons, let's get into that. And I think as I'm talking, I'll probably think of more pros. Some of the cons are, sometimes facilities don't pay you. Okay. I know you're probably like, what do you mean they don't pay you? So sometimes you'll send nurse, right? You'll send a nurse, because remember, you have to pay your nurse no matter what. You have to pay, you bill the facility every week on a weekly basis. So therefore you have to pay your nurse, whether you decide every 2 weeks or 1 week, whatever it may be. It's up to you. But sometimes the facility will just, and I've had this happen to me, where a facility literally did not pay. So they just stopped paying their invoices. And we called several times. We sent several messages. It was just like, almost like we were being ignored, right? And this is after our staff has already worked. We've already paid our staff, using a funding company, which we have to pay back, right? So sometimes facilities won't pay. I know a couple people that, the facility is owing them more than $1 million, $500,000, So yeah, so just be mindful of that when you're coming into the facility. One thing I will say, especially if you're dealing with a long-term care facility, assisted living, nursing home, just kind of test the waters first. Because the tendency is, especially because they have such a need, they'll keep requesting your staff. They'll keep requesting more and more and more and more staff, right? But guess what? With more and more and more staff, you have more and more invoices that might not get paid, right? So what I always recommend is maybe start off with just like 2 staff, placing 2 staff there on a consistent basis, and just watch their pattern of payment, right? If they are one that they don't pay till 90 days and your agreement with them says 60 days, then that should be a red flag for you. Like, okay, hold on. Either you need to go back and talk to the administrator, or whoever is the corporate HR, whatever it's like that, and tell them, hey, this is a breach in our agreement. We agreed 60 days and you guys have been paying in 90 days. So what's going on? And take action right away. Take action. The mistake I made is I didn't take action right away. I was just like, oh, okay. I was new. I was new to the staffing industry. So I was just like, okay, well, okay, they'll pay. They'll pay and they'll pay. And it turned into they didn't pay. So that's one of the con. And another con is it is heavily reliant. So the staffing industry is heavily reliant on people working, right, and finishing their contract. If you're doing contract staffing, it is heavily reliant on that person actually being a person of their word or whatever, or finishing their contract. So if they don't finish their contract, that nice amount that you calculated you were getting paid, you don't get paid, right? So that's something to be mindful of. I learned it the hard way, because sometimes you make plans based on that amount. You're like, okay, I'm going to do this, I'm going to do that based on that amount. But if the person doesn't finish their contract, you don't get that amount, right? Another con is sometimes you can get penalized if someone doesn't finish their contract. Sometimes there is a penalty, right? If someone doesn't finish their contract, sometimes there's a penalty for it. Some facilities will charge you a fee. Just make sure you read your contract very carefully. Make sure your contract pleases you, works better for you. Yeah, because the example is there was a contract with a long-term care facility. I was going to get access to staff a lot of the facilities, right? It was a corporate contract. But in the contract, they wanted me to put that they would charge me whenever my staff canceled. So let's say there was an emergency and, the RN couldn't come to work, or the CNA couldn't come to work, I would get charged. And I told them, I said, that makes absolutely no sense, because that's beyond my control. If, everybody has emergencies, so I will get charged every time they cancel. So I didn't go ahead with it, right? So, and another thing is, not every contract is a good contract. So just be mindful. Sometimes you might have to turn down some contracts. Another con that I can think, I'm trying to think of another con. Another con is that it does get expensive. So over time, if you're not careful, the staffing business, right, for you can rack up between all the softwares, the ATS, applicant tracking system, the CRMs. Just be mindful, because over time it can add up, right? Softwares want to sell you things and make it seem like they're a solution for this and this and that, and they're really not. They help, but so just be mindful. It can get expensive over time if you're not adequately paying attention and doing your research. So those are some of the cons with owning a staffing agency. Let me see. Another con is when you get into travel nursing. Another con is, to be honest with you, and I can say this because I'm a nurse, right? So is dealing with some nurses. Is dealing with some of the nurses. I'm a nurse. I'm still a nurse. You know what I mean? I love the nursing field, but sometimes it can be hard dealing with certain nurses, and that's just dealing with people in general, right? This is a people driven business. You have to deal with people. Like, you can't just be like, oh, I don't want to deal with anybody, I don't want to talk to anybody, especially if you're just starting out. You're going to be your recruiter, you're going to be your account manager, you're going to do payroll, right? You're going to do marketing for your company, so you're going to handle compliance for your company as well. So you're going to do all roles, right? So you have to be comfortable with dealing with people, with speaking with people, with interacting with people as well. So those are some of the cons that I can think of. It is still, even with all those cons, I would still recommend, if you are thinking about it. Another con, one more con that I just thought of is, I always tell, when I do counseling, when I do mentorship for new people that are interested in coming and starting a staffing agency, I always tell them, just prepare yourself mentally, because sometimes contracts are not as easy to come by, right? Especially if you're a new agency. It stinks because, a lot of them expect you to have 2 years, and then you're like, how can I have 2 years if no one will give me a try, right? So if you're a new agency, sometimes it might take you a year to get a new contract. I'm not wishing that on you. I'm hoping yours will be different, right? So just be mindful of that as well. It's not a quick, I come in, I get contract, boom, 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 right? Just like that. So I would definitely utilize my network that I have before you come into staffing. Start getting the word out there, start utilizing networks and telling people, and connecting with possible places that can give you contracts as well. So those are some of the pros and cons of owning a healthcare staffing agency. If I think of anything else, I will put it in the description as well. But yeah, thank you for watching this video. If you have any questions, feel free to message me down below. Send me a message. If you are interested in being a travel nurse, or you are looking for a permanent job in healthcare, or just looking for a local contract or per diem work, my team is ready to help you, right? So give us a call at 1-877-295-2217. Give us a call. You can always send an email to any of our recruiters at recruiter@mobilehealthstaffing.com. You can also check us out on our website, which is www.mobilehealthstaffing.com. Okay, guys, have a wonderful rest of your day, and feel free to send me any message below. Take care. Bye.